Good evening to all of you. Is my voice clear, audible? Is my voice clear and audible? We are going to discuss about adverse drug reaction, that is about drug toxicity. The topic drug toxicity or adverse drug reaction, both are same. So is my voice clear? Okay, fine. So we are going to start shortly. Please inform your friends who have not joined that our class has been started. Please inform your friends that our class has been started. Okay, meanwhile, let me ask you some questions of previous classes. Write down in chat box. What is the content of oral contraceptive pill? We are waiting for your friends to join the class. What are the contents of oral contraceptive pills? Write down in chat box. Inform your friends to join the class. What are the contents of oral contraceptive pills? Write down in chat box. We are going to discuss today about adverse drug reactions or drug toxicity. In your syllabus, drug toxicity, it is written, so it is similar. Write down content. What are the contents of oral contraceptive pills? So students who are joining now, I have asked one question. What are the contents of oral contraceptive pills? Yes, I am getting reply. Levonorgestrel. Then e-pills. I think you are finding from Google. You are not remembering the class or you are not reading textbooks. What are contents of oral contraceptive pills? Simple question. What oral contraceptive is made up of which drugs? It's a very simple question. Still students are joining, so inform your other students, other colleagues also to join that our class has been started. Please inform that so that we can discuss today's topic, that is adverse drug reaction or drug toxicity. What are the contents of oral contraceptive pills? I am not getting proper reply. The reply is there, but that is not proper. Another question. What are the adverse effects of oral contraceptive pills? Still, answer of first question is not over, but what are the adverse effects of oral contraceptive pills? We are waiting for your friends to join. Yes, I am getting reply. Weight gain, correct. Nausea. Nausea, yes. Why do you forget the contents of oral contraceptive pills? Estrogen, progesterone. Simple answer is that levonorgestrel, it is also there, but you can write down like estrogen and progesterone. Yes, I am getting reply. Skin changes, weight gain, migraine, flushing. Any other cardiovascular side effects? Any cardiovascular side effects of oral contraceptive pills? Cardiovascular. Hypertension, yes. Other side effect, osteoporosis. Okay. Inform your colleagues that our class has been started, so to join them as early as possible. We are now starting with adverse drug reaction. So drug toxicity or adverse drug reaction, we have studied in many drugs that after mechanism of action or after use, there is adverse drug reaction. So now this class is just on that part. And in your exam, adverse drug reaction or drug toxicity can be asked as a short note also. So this will be helpful for you. So what is adverse drug reaction? That is the harmful effect. That is what we considered in layman tongue as harmful effect. And there is also definition of adverse drug reaction. So we have to learn that definition given by WHO also. So harmful effect associated with the given medication or unwanted. These adverse drug reactions are unwanted. Generally, what is wanted from the drug? Actions, which is desirable action or beneficial action, that is wanted from the drug. But whatever the other effects which are produced, which may be harmful generally, these are side effects or adverse drug reaction. So unwanted or harmful reaction experienced after administration of the drug or combination of the drug under normal condition of use. Again, I repeat, unwanted or harmful reaction that is experienced after administration of the drug or combination of drug or one or two or more drugs. We have many times we are using two or more drugs. Even then also this harmful reaction is produced. That is adverse drug reaction. Again, there is definition by WHO. Whenever we are writing short note, we have to write down this definition. So a response of the drug which is noxious. First term is noxious. Noxious means harmful, which is unintended, harmful, noxious, and unintended, and which can occur at the doses normally used in men for. So first of all, here dose. Which are the dose which are used normally? See, whenever we are using drugs above their normal dose limit, obviously harmful effect will be produced. Suppose the drug of the dose is 500 milligram, paracetamol 500 milligram, and we are using 1500 milligram. Of course, the adverse effect will be produced, but the adverse effect which is produced at the normal dose, here in definition it is normal dose. In men, for this drug, whenever are used for prophylaxis or for diagnosis or for therapeutic, means treatment purpose. So as you know, that drug can be used for prophylaxis, meant for preventing infection. Like in case of the corona, you may have heard the name of hydroxychloroquine. Hydroxychloroquine is used in healthcare provider in special situations for prevention of the corona. That is called prophylaxis. So if the drug is used for prophylaxis, for diagnosis purpose, so many drugs can be used for diagnostic purpose also. Or most common use of the drug is therapy. That is for treatment purpose. Whenever for this purpose drug is used and at the normal dose, and it produces noxious or unintended reaction, it will be considered as the adverse drug reaction. So diagnosis or therapy of the disease for the modification of physiological function, that is called as for pharmacological action. So again, I repeat the definition: response to a drug which is noxious and unintended. So two types of the response: noxious and unintended response. At which doses? Normal doses. At normal doses, when the drug is used for prophylaxis, diagnosis, or therapeutic purpose, and which is used for modification of the physiological function, that is for pharmacological action. I think you may have remembered this definition. So adverse drug reaction, it may lead to significant morbidity and mortality. So because of the adverse drug reaction, there can be morbidity. Morbidity means diseased condition. Patient is ill, that is morbidity. Many times what happens that whenever we are treating any patient at that same, because of the drug, whatever the disease is there, that may be relieved. But because of the drug, there can be adverse drug reaction and patient may experience morbidity. And because of the adverse drugs reaction, there can be mortality also. For example, if penicillin is used, and because of penicillin there is hypersensitivity. We are using penicillin for so many bacterial infection, if you remember, and because of penicillin there can be hypersensitivity reaction, and this hypersensitivity reaction may lead to rash. It may lead to rash. So that rash is morbidity. That can be morbidity. But because of this hypersensitivity reaction due to penicillin, there can be anaphylaxis. There can be anaphylaxis, and it may lead to death also, and that is mortality. So adverse drug reaction may either produce morbidity or mortality. This morbidity or mortality range from mild reaction to severe reaction. And the reaction can be mild or reaction can be more severe also. In between, moderate reaction can also occur. So mild reaction, example of the mild reaction: drowsiness, nausea, itching, and rash. I have given already example of penicillin. So nausea, vomiting, it can occur with, of course, so many drugs. In almost all drugs, we have learned that nausea and vomiting can occur. So this nausea and vomiting, these are mild reaction. And severe reaction, like here anaphylaxis and death. So that is severe reaction. So respiratory depression, neutropenia, then this hepatocellular injury, in hemorrhage, and anaphylaxis. We have already given the example. So let me see how many students have joined. 25 students. So please ask your colleague that our class, it is very interesting. Adverse drug reaction. That is an opportunity to learn about adverse drug reaction. So ask them to join. So adverse drug reaction are most common in women. That can be common in women, in elderly person, that is greater than 60 years of the age, when very young, that is 1 to 4 year child, and patient taking more than one drug. So there are always chances that because of one or another drug, there can be adverse drug reaction. So obviously that this young age and elderly persons, these are the risk factor for developing adverse drug reaction. These are also the risk factor for developing many other diseases also. So classification of the adverse drug reaction, there are two ways of the classification. I'm going to discuss both of the ways. Both are very easy ways, and you can write down both the ways or either way. So first of all, it can be classified as type ABCD reaction. No need to remember this name. So type A reaction. These reactions are related to pharmacological actions of the drug. Type A reactions are related to pharmacological actions. We have studied in many drugs about pharmacological action. Suppose adrenaline produce rise in blood pressure, that is pharmacological action. So because of the pharmacological action, because of the adrenaline which produce rise in blood pressure, it may lead to hypertension. So that is type A reaction related to pharmacological action. So extension of the principal pharmacological action of the drug. Extension. Normally, it is rising blood pressure to 10 to 20 millimeter mercury, but above more than 50, 60, or it may lead to the condition when there is hypertension. So it is extension of the pharmacological action. Extension means normal, it is beyond normal limit, So that is example of this type A reaction. Then this type A reaction, it can be predictable, as we know that adrenaline produce rise in blood pressure, so it may lead to hypertension. So that is predictable. We can know that. As well as we can know that this antihistaminic drug produce sedation. So it is predictable. We can predict that it may lead to sedation. આ દવા લેવાથી આવું થઈ શકે એવું આપણે કહીએ છીએ. That is predictable. Then it is common. Type A reactions are type A serious reactions are not they are not serious but common, and that is dose dependent. Usually whenever we rise the dose, whenever we increase the dose, the reaction, type A reaction will be more increased. So mainly remember the type A reaction are because of their pharmacological actions, because of pharmacological action, that is predictable, common, and dose dependent. So in type A reaction, again, some classes are there. First of all, toxicity. What we call toxicity, that is because of the overdose, drug overdose. That is same. So adverse drug reaction caused by excessive dose. Excessive. Whenever we are increasing dose, excessive dose, it may lead to this adverse reaction, that is toxicity of the. So for example, hepatic failure with that high dose of paracetamol. This is a symbol of high. We are giving normal dose of paracetamol 500 milligram twice a day or 3 times a day. But whenever we are giving more than the normal dose, 2000 milligram, it is not to be given. Just hypothetically, I am telling you. So because of this high dose of the paracetamol, it may lead to hepatic failure. Then with antihypertensive headache, hypoglycemia with sulfonylurea. Sulfonylurea are the drugs which are used in diabetes. Whenever you are giving a dose which is above normal limit, it will lead to hypoglycemia. So common problem with anti-diabetic drug is hypoglycemia. We have discussed in case of the diabetes that because of the skipping of the meal or because of the high dose of the anti-diabetic drug, when we are giving dose overdose, see here, because of the overdose the drug is reaction is produced. So that is example of toxicity of the overdose. Then second thing is side effects. We are commonly using this term to denote any adverse drug reaction or to denote the toxicity. But again, there is difference between toxicity, between side effects. So side effects are what? These are nearly unavoidable secondary drug effect produced at therapeutic doses. Unavoidable. Side effects will be mostly produced. Okay. These are the secondary drug effect and produced at the therapeutic dose. Remember, in case of the toxicity, the drug toxicity is produced by overdose, while side effects are produced at therapeutic dose. So intensity here is dose dependent again. It occurs immediately after initially taking the drug or may not appear for several weeks. It depends. So immediately it can, some of the examples, sedation with antihistaminic, it may occur immediately, within some hours, within some minutes, okay, or it may not occur since some week also. So it depends upon the drug, it depends upon many other factors, it depends upon the host factor also. So that is about side effect. Then secondary effect, secondary pharmacological effect. That is, for example, we are giving the drug to treat some X condition, and because of the drug Y condition is produced. That is secondary pharmacological example. Here example is given: development of the diarrhea with antibiotic therapy due to alteration of the GIT flora. Diarrhea because of the antibiotic therapy. So we are giving antibiotic therapy for treatment of the bacterial condition. That is our condition X, bacterial condition, and we are patient is developing diarrhea. That is Y condition. So that is secondary pharmacological effect. Second example: orthostatic hypotension with phenothiazine drug. Orthostatic hypotension with phenothiazine. So that is also secondary effect. Okay, let me ask you some question. What do you mean by adverse drug reaction? Definition we have discussed already. What do you mean by adverse drug reaction? I have explained that definition clearly. So write down the answer. If you remember the WHO definition or simple definition of adverse drug reaction. So what is adverse drug reaction? Write down. You can write down shortly some words also. Adverse drug reaction, definition of adverse drug reaction, or just meaning of adverse drug reaction. We have discussed it. Reply in chat box. What is adverse drug reaction? Yes, I am getting reply. Unwanted reaction experienced after administration of the drug. Undesirable and unwanted effect of the drug. Yes, any other? Harm associated with the use of the medication. Any other? According to WHO definition, undesirable or unwanted effect due to a drug administration. Yes. Any other reply? Unwanted effect of the drug according to WHO definition. undesirable reaction after the drug. Okay, fine. You will see that definition again. You are right, but according to WHO, you have to remember. So all these recordings will be also available in YouTube. Previous recordings are also available on YouTube. So you will be able to watch that n number of times. You can use this all the lectures for your revision also. They are already available on YouTube. After some within 24 hours, YouTube uploads this automatically on the channel, so you can watch it later on also. So yes, I am getting one reply. Adverse drug reaction in pharmacology: any unexpected or dangerous reaction to a drug, an unwanted effect caused by administration of the drug. Onset of adverse reaction will be sudden or developed. I think you have searched for search somewhere else. Noxious and unintended. Yes. So now we are moving further. Drug interaction. So in adverse drug reaction, we have seen about toxicity, then the side effects, then secondary effects, and now drug interactions. Generally, in individual discussion of the drug, we skip the drug interactions. So as the name suggests, drug interaction. So that is the interaction between two or more drugs, and because of this interaction, when the drug whenever the adverse effect is produced, it is called as drug interaction. When two drugs are taken together and they affect each other's response, pharmacologically or pharmacokinetically, then it is drug interaction. So one drug slow the metabolism of the second drug. That is one of the example. If giving one drug, it will slow the metabolism of the second drug, and so the blood level will be increase and it will lead to toxicity. For example, theophylline toxicity in presence of the erythromycin. Erythromycin slows the metabolism of the theophylline, so the level of the theophylline it will be increased, and because of that theophylline toxicity, that will lead to drug interaction. So drug interaction, that is because of the two or more drug whenever taken simultaneously. So then type B reaction. Until that, this were type A reaction. Side effect, toxicity, drug interaction, all these were type A reaction. Now type B reactions. These are unrelated to non-pharmacological actions of the drug. These are not common pharmacological actions of the drug. Suppose adrenaline produce hypertension, that is common pharmacological action. But if adrenaline produce rash, that is not common pharmacological action. That is not related to its action. That is the side reaction. Then it can be unpredictable. We cannot predict which action can occur, which adverse reaction can occur. Then these are caused by immunological or pharmacogenetic mechanism. Here genetic also play a role. Immunology also play a role. These are unrelated to dose. And type B reactions are more dangerous. Here we cannot predict. It is not related to dose. Comparatively, these are rare and common. Serious illness or death, these are rare. Type A reactions are common. Type A reactions are predictable. Type A reactions are related to dose, and type A reactions are mild, and when in very few occasions it is severe. But here these are rare but serious. Type A reactions are common, but these are mild. So that is difference between type A and type B reaction. So it is results in type B reactions, results in withdrawal of the marketing authorization. Whenever the type B reaction, unwanted reactions are there, it may lead to withdrawal of the marketing of the drug. Drug is withdrawn from the market. For example, previously selective COX-2 inhibitors, rofecoxib and valdecoxib were there. Because of them, this rofecoxib and valdecoxib were used for treating gastric ulcer, for treating hyperacidity. That were used for treating pain. These are the drugs which are used as painkiller. But because of this drug, there were cardiac side effects, and because of that, rofecoxib, valdecoxib were withdrawn from the market. So many examples of the drugs which are withdrawn from the market. So they may not be discovered until the drug is marketed. So type B reactions are only discovered when the drug is available in market and used by the patients. So they may not be discovered during the clinical trial phase 1, 2, 3. Both environmental and genetic factor also play important role in this reaction. So what are the classes in drug type B reaction? First is drug intolerance. So lower threshold to normal pharmacological action of the drug, that is drug intolerance. Simply patient cannot tolerate the drug. Threshold of the pharmacological action of the patient is lowered. So tinnitus, that is the adverse effect of the aspirin. So aspirin, here also there is nothing related to aspirin tinnitus with the pharmacological action of the aspirin. As you know that aspirin is used as a antipyretic drug, or in case of the pain also, and antipyretic action is produced because of inhibition of COX enzyme. So there is nothing related to pharmacological action and tinnitus, and even though tinnitus may be produced in many patients, so there is drug intolerance. Second is hypersensitivity reaction or immunological reaction, that is immune mediated response. In so many drugs, you have learned about this hypersensitivity reaction. For example, in penicillin hypersensitivity reaction, we have given the example, mild reaction like rash and severe reaction like anaphylaxis can occur. So these are type B reaction. Immune mediated response to the drug agent in anaphylaxis in penicillin, we have discussed already. Then pseudo-allergic reaction, that is because of the direct mast cell sensitization and degranulation. As you know that mast cell, it may lead to release of the mediator of the allergy. So these are pseudo-allergic reaction. Then idiosyncratic reaction. In your syllabus, you have seen that our drug toxicity, or that is idiosyncratic reaction, it is also written, so it is being also covered. It is an uncommon and abnormal response of the drug due to genetic abnormality. Remember that idiosyncrasy is because of genetic abnormality. That is, in person's genetic, there is abnormality. Idiosyncratic reaction can occur. It can affect the drug metabolism and receptor sensitivity. So idiosyncratic reaction cannot occur in each and every person. If there is genetic abnormality is there, only because of this genetic abnormality, drug metabolism and receptor sensitivity can be affected. It can be harmful, even fatal also. It can lead to death also and appear in low doses. It can appear even in low doses. For example, idiosyncratic reaction, anemia, hemolytic anemia, particularly by antioxidant drug. Because of G6-peptide deficiency in persons who are G6-peptide deficient. So some of the drugs, if they are given antioxidant drug, it can lead to hemolytic anemia. So G6-peptide deficiency, it is genetic abnormality, and anemia produced is idiosyncratic reaction because of the antioxidant drug given in them. For example, primaquine. If we give primaquine, it may lead to this hemolytic anemia. Second example, paralysis due to succinylcholine enzyme deficiency. Then type C, chronic reaction. These are associated with the long-term therapy. Chronic is the name chronic, so long-term drug therapy. These are well known and can be also anticipated. Only type B reaction cannot be anticipated because these are not related to this pharmacological action. Type A and type C. C is chronic. Reaction can be anticipated, can be predicted, but these are chronic. There is with long-term therapy. Adaptation can occur and it can lead to discontinuation of the drug or abstinence syndrome with the opioid, alcohol, barbiturate. So with the long-term drug therapy, whatever the chronic reactions are, whatever the chronic drug reactions are produced, these are type C reactions. Suppose with the use of the steroid, corticosteroids, there can be steroid-induced cataract. So that is example of the chronic drug reaction. Type D, delayed. D is for delayed. So it can be carcinogenic or teratogenic effect. So carcinogenic, cancer-producing effect. Because of the drug, there can be cancer. This is delayed in onset. Suppose for long term, very long term, 5 years, 10 years. So delayed in onset, these are very rare. So carcinogenic and teratogenic. Just remember this both name, carcinogenic and teratogenic. Whenever it is taken more than 20 years to develop, it can take even more than 20 years to develop also. Yes, and teratogenic effect. Carcinogenic is cancer producing. Now, second thing is teratogenic, that is effect drug-induced birth defect. Whenever the drug is given during pregnancy, it may lead to birth defect. One of the famous examples of thalidomide. Thalidomide previously widely used, and it was because of the teratogenic effect, it was withdrawn from market. Second example is, if we give iron in first trimester, it may lead to failure of the organ development. So iron have teratogenic effect during first trimester. So it is to be given from second trimester onwards only. So teratogenic effect is to the fetus. Carcinogenic effect is cancer producing effect. So that were type A, B, C, D reaction. Again, just we have a look. Type B reaction, type C reaction, chronic, and type D delayed reaction. Another classification, it is also mentioned like type A, B, C, D, but here type E and F reactions are also there. So we will just have an overlook of this classification also, and it is also interesting. Here also there are some examples, so it is easy to remember. So I have kept that part also. Here again, severity of the drug reaction can be minor, can be moderate, can be severe, or can be lethal. Lethal means it may lead to death. That is lethal effect. Another classification is there according to onset of the drug. That is acute reaction, acute adverse drug reaction. Whenever the adverse drug reaction is produced within 60 minutes of taking drug, it is acute drug reaction. Acute drug reaction. Then subacute. That is whenever the drug is whenever the adverse effect is between 1 to 24 hours after taking drug, whenever it is produced between 1 to 24 hours, it is subacute. And latent, that is whenever the drug effect is produced greater than 2 days, that is latent. Okay. So let me ask question: what type of the adverse reactions you have learned till now? Write down in chat box types of adverse drug reaction that you have learned. What type of adverse drug reactions that you have learned? Write down in chat box. Only 27 students. All seem to be very busy. All others seem to be very busy. What types of adverse drug reactions you have learned till now? Write down in chat box. Types of adverse drug reaction. We have discussed about different types. Write down in chat box. If other students want to join, they can join till now also. Okay, type A, B, C, D. Yes, but what is type A, B, C, D? Yes, delayed reaction, idiosyncratic reaction, then chronic reaction. Okay, idiosyncratic. Type D is delayed, C is chronic. Yes, because of the pharmacological action. Okay, chronic reactions. Do you remember difference between type A and type B reaction? Acute, subacute, chronic. Subacute reaction, have we learned like that? Subacute. Difference between type A, yes, predictable, common. Type A is predictable and common. Yes, very nice. Then type D, yes, carcinogenic and teratogenic, mild, moderate, severe, lethal. Okay. What is difference between type A and type B reaction? Type B is serious and rare. Okay. Other difference, type A is because of pharmacogenic, not pharmacogenic, but that is because of pharmacological action. Type B is unpredictable and rare. Yes. Type C is also with the long-term drug therapy, chronic. Yes. Okay, we are now moving further. So that is another type of the adverse. That is another type A. So there is some error. Type A here is augmented or dose related. That is similar to what we have learned. Commonly related to pharmacological actions. So it is similar. Type A here it is dose related or pharmacological action. As we know, it is predictable, having low mortality. Similar example is dry mouth with tricyclic antidepressant (TCA). Then respiratory depression with opioid. Bleeding because of the warfarin. So warfarin is, as you know, that antiplatelet drug, and because of the antiplatelet drug, there can be bleeding. So it is because of the pharmacological action. It is predictable. Tricyclic antidepressant (TCA) may lead to anticholinergic action, and because of the anticholinergic action, there is dry mouth. So that is dose related. That is because of the pharmacological action. Opioid may lead to respiratory depression. That is also because of the pharmacological action. Opioid has the action on the respiratory system, that it depresses the respiratory system. I think you have understood this because of the pharmacological action. Management of this type of the reaction: reduce the dose or withdraw the drug if possible. Consider the effect of the concomitant therapy. Then type 2 reaction, these are bizarre reaction. Type B reaction, these are bizarre or non-dose related reaction. That is similar to type B we have learned. Uncommon, not related to pharmacological action. These are unpredictable, that can lead to high mortality. That is similar. Immunological reaction, that is anaphylaxis because of penicillin. Malignant hyperthermia with general anesthetics. General anesthetics leading to malignant hyperthermia. Again, it is not related to pharmacological action. There is nothing like nothing related to general anesthesia and this producing hyperthermia. Similar to penicillin. Penicillin doesn't have any action of anaphylaxis, even though it is produced. So that is type B, bizarre reaction, uncommon, not related to pharmacological. So here withhold or avoid in future. This drug should not be given. Type C, again chronic reaction. These are dose related and time related, uncommon, related to cumulative dose. Hypothalamo pituitary adrenal axis suppression due to corticosteroid. We have discussed in case of the corticosteroid that it may lead to withdrawal. Because of the withdrawal of the corticosteroid, suddenly it may lead to suppression of the hypothalamo pituitary adrenal axis. Osteonecrosis of the jaw because of the bisphosphonate. So again, management is same, reduce dose or try alternate therapy. Type D is delayed reaction. Type D is time related delayed reaction. We have seen uncommon, usually dose related, occurs in sometimes after the use of the drug, like carcinogenesis, teratogenesis. We have seen already. Tardive dyskinesia. Here the photograph of the tardive dyskinesia is there. Leukopenia with this lomustine, tardive dyskinesia. And management is often intractable. We cannot manage many times. End of the use. E is withdrawal reaction. Simply E is end of the use. That is what we have not learned. Type ABCD was the similar as per previous classification. Withdrawal, simply speaking, end of the dose. Whenever there is alcohol withdrawal, nowadays because of the lockdown, alcohol was not available in previous days in many states. So because of the alcohol withdrawal, whatever the reactions were produced, like headache, vomiting. So these are withdrawal reaction. Like you have seen in one movie of that Sanjay Dutt. In that also alcohol, the withdrawal reaction because of the drugs, because of the addiction withdrawal. That reactions have been shown in that movie. Feeling of the cold, excessive cold, or feeling of the excessive hot many a times. So these are the withdrawal reactions. Uncommon, that occur soon after the withdrawal of the drug, and most commonly because of the withdrawal of the opioid or benzodiazepine. Insomnia. A patient is taking opioid drugs or benzodiazepine for treatment of the insomnia. Whenever the drug is withdrawn, patient may again experience this insomnia and anxiety. So management is reintroduce the drug and withdraw slowly. Slow withdrawal is needed. Failure, that is unexpected failure of the therapy. This is also common. Failure of we are giving the drug and even the response is not achieved. So it is also common. Again, it is dose related and it is caused by drug interaction. For example, inadequate dosage of oral contraceptive may lead to pregnancy. It may lead to pregnancy. So inadequate dose, we should be given, the oral contraceptive should be given in proper dose. Then it may lead to, if it is not given in proper dose, it may lead to pregnancy. So that is the failure of the oral contraceptive. Again, it is another classification. It is also important, and you have learned already minor reaction, moderate, severe, and lethal. For minor, no therapy is needed, or if antidote is available, we can give antidote. For moderate adverse drug reaction, it requires change in the drug therapy. In case of the moderate drug reaction, change of the drug should be required. Many times hospital stay is required. In severe, always hospital stay is required because they are life-threatening condition. It can lead to permanent damage or require intensive medical treatment. and lethal directly or indirectly. It may contribute to the death of the patient. So what are the signs and symptoms? We have already seen a mild, moderate, severe reaction. It depends upon the first dose. Signs and symptom depends upon the first dose. Allergic reaction. It can occur soon after the drug is taken second time. Most commonly in allergic reaction after second time, soon after the drug is taken, it can lead to this allergic reaction. And signs and symptoms: itching, rash, eruption. So there can be some eruption over the skin. Upper and lower airway edema. There can be edema of the airway. So inside the neck there can be edema, and it may lead to difficulty in breathing. So dyspnea, that is difficulty in breathing, and hypotension. Itching, rash, eruption, upper and lower airway edema, dyspnea, and hypotension. So idiosyncratic reaction. What is idiosyncratic reaction? We have learned. Yes. What is idiosyncratic reaction? Write down in chat box. What is idiosyncratic reaction? We have learned already. So write in chat box. What is that? Idiosyncratic reactions. What is idiosyncratic reactions? Write down in chat box. I will be giving you assignment on this class also in form of Google form, and it will be open depending upon the availability of this lecture on the YouTube. So it will be open mostly for 24-hour assignment, and you have to write down the answers of that assignment. I have asked, what is idiosyncratic reactions? Idiosyncratic reactions are because of what? So yes, I am getting answer. Genetically determined abnormal reaction. Genetically determined abnormal reaction. Again, search in Google and copy pasted. Yes. But the thing is that basically you understand the term usually due to genetic abnormality. Yes. That do not occur in most patients at any dose and do not involve any non-pharmacological property due to genetic abnormality. That anemia by antioxidant drug. Yes, that is, I think you have written depending upon our lecture. Okay, true. Fine. So mechanism of adverse drug reaction, type A and type B. So these are we have discussed already: non-immunological, reversible with reduction of the dose, non-serious. Type A, extension of the pharmacological action. Type B is biochemical reaction, unrelated to pharmacological action, and immunological hypersensitivity or non-immunological because of the pseudo allergy or idiosyncratic or intolerance. So these are mechanism in one slide. It has been this mechanism of adverse drug reaction. See, because of the extension of the pharmacological action, that is mechanism. Because of unrelated pharmacological action, that is also mechanism. Because of the immunological reaction, hypersensitivity, that is mechanism. Pseudo-allergy, idiosyncratic, these are all terms which is used as mechanism of adverse drug reaction. Mechanism of type B reaction, this is often mediated by chemically reactive metabolite. Some metabolites are there which can mediate this type B reaction. It can lead to non-detoxification of the metabolite. So whatever the metabolites of the drug are there, they are not detoxified. So it may lead to direct cytotoxicity. So metabolites are toxic and it may lead to toxicity, and it can lead to direct tissue damage or necrosis. Then common form of adverse drug reaction. See, these type 1 reactions are IgE mediated. Here type 1, 2, 3, 4 as it is described. Type 2 reactions are cytotoxic. Type 3 reactions are immune complex mediated, and type 4 are delayed or cell mediated. So these are the hypersensitivity reactions. There are 4 types of the hypersensitivity reaction: type 1, 2, 3, 4. Again, I repeat, type 1 hypersensitivity reaction is IgE mediated. Type 2 is cytotoxic. Cytotoxic means damage to cell. Type 3 reaction is immune complex, and type 4 is delayed hypersensitivity reaction. You may be learning in pathology as well as in microbiology also about hypersensitivity reaction. So that was about the various classes of adverse drug reaction. Now, second part of this is about monitoring of the adverse drug reaction. We will take 10 minutes. So, how to monitor? So, monitoring of the adverse drug reaction means detecting adverse drug reaction. We have to detect whether the adverse drug reaction is produced in particular patient or not. After detection, second step is documentation. We have to document it in form of the system, in form of the software, in form of the pen and paper system also. Then report it. So detection, documentation, and reporting to pharmacovigilance center. I will explain this terminology. So reporting to pharmacovigilance. You know, vigilance. Vigilance is there in case of the police system, in case of this crime. So here pharmacovigilance, that is pharmacological system is, vigilance system is, it is a system which is working for detection of adverse drug reaction. I'm going to show the definition also. Then assessing the causality between drug and suspected reaction. So first thing in monitoring of the adverse drug reaction is detection, then documentation, then reporting, and assessing causality. So pharmacovigilance, it is defined as the science and activities related to detection, assessment, understanding, and prevention of adverse drug reaction or any other drug related problem. So it includes detection of the adverse drug reaction, assessment of the adverse drug reaction, understanding of the adverse drug reaction, and prevention of the adverse drug reaction. So there are we have talked about pharmacological vigilance center. So in Rajkot pharmacology department is pharmacovigilance center. In each medical college, pharmacology department, these are working as pharmacovigilance center. So anyone can report this adverse drug reaction to pharmacology department of the medical college. So role of healthcare professional in detecting adverse drug reaction. If you are working in hospital, and so what is your role to detect this adverse drug reaction? So possibility of the adverse drug reaction should always be considered during differential diagnosis. So if we diagnose the conditions, and we have to keep in mind that it can be because of the adverse drug reaction also. So it can be detected in ward, during the round, during the OPD also. So in role of healthcare provider is patient counseling and medication history interview. We have any patient if reports to us with complaint of nausea and vomiting, we have to also ask about medications which is being currently taken. Any patient who is showing the signs and symptoms of hypoglycemia, we have to consider the history of anti-diabetic drug also. Because of anti-diabetic drug, this hypoglycemia may be produced. So medication history interview, communication with the other healthcare professional. So patients who are at this higher risk should be monitored closely. As we have discussed that more than 60 years of age, women, then 1 to 40 years of the age, these are at the higher risk. They should be monitored closely. So other conditions in which patient close monitoring is needed, that is renal condition, hepatic impairment, patient who have history of the allergic reaction. Previously, if there is history of penicillin allergic reaction, because of the penicillin, there are development of the rash, then patient should be monitored closely, or we should take due care in administration of the penicillin. Then patient taking multiple drugs, pregnant and breastfeeding women, they are also at the high risk. So they should be also monitored closely for any adverse drug reaction. Again, I repeat, patient with renal or hepatic impairment, patient who have had a history of the allergic reaction in past, patient taking multiple drugs, pregnant and breastfeeding women, they should be also monitored closely. So reporting, what may happen if you are not reporting? So it may lead to skipping of the adverse drug of the notice of towards the notice of the pharmacovigilance center. So who can report? All healthcare professional, all doctors, dentists, pharmacists, nurses, everyone can report this adverse drug reaction. Even physiotherapists, all can report this adverse drug reaction. Non-healthcare provider also can report this suspected adverse drug reaction. Where to report? I have already told that is nearest pharmacovigilance center, monitoring center, that is pharmacovigilance center in medical college. And these are the helpline number. This is the nationwide site of this AMC Adverse Drug Monitoring Center. This is the site address. What to report? So report serious or adverse reaction. Any adverse reaction can be reported. It is not so that only serious adverse reaction can be reported. Common adverse drug reaction can be reported according to pharmacological center, but it is recommended that life-threatening reaction which require hospitalization, reaction which is leading to disability, congenital anomaly, that can be reported. Report non-serious reactions also, known or unknown, that can be also reported. Reaction due to medications, due to vaccine, due to herbal product, it can be also reported. So this is the form for reporting to adverse drug reaction, suspected adverse drug reaction reporting format. And here some details like patient's initial, age at the onset, reaction terms, what are the reactions, what is the date of the reaction, suspected medication, and reporter's information, who have reported their information, his or her information is to be written in this form. So adverse drug reaction, what happens to the submitted information? It is reported by healthcare provider or patient. We report this in form of this form. So there is causality assessment. That is why this has happened. So causality assessment includes whether it is happened due to drug or not. Then it is forwarded to higher center to maintain database. Data is analyzed and forwarded. Reports periodically reviewed. And this, if you not remember this thing, that can be okay. So that is all about adverse reaction. We will again meet tomorrow. Okay, so thank you very much, and I will be giving you this Google form assessment, which we have to write down answers depending upon this lecture. Thank you very much.